Thank you for waking up with us. More than 5 million Americans suffer from Alzheimer's disease. It's a disease that affects the whole family. This morning, Dr. John Bertelsen, I promise I would get that right, Chief of Neurology for Seton Hospitals, is here today to talk about those effects. Thank you so much for being here with us.
Thank you, Katina.
Yeah, sure. Now, there's a sort of a misconception about Alzheimer's and dementia, and they're two completely different things. Can you talk about that, and what's the difference between the two?
Sure, that's right. And I guess the easiest way to think of the difference is that dementia is not a diagnosis, whereas Alzheimer's disease is a diagnosis. Dementia means that there's a significant decline in somebody's thinking, usually with a loss of short-term memory. Now, this decline is so severe that people struggle to do the things that they used to be able to normally, such as drive safely without getting lost, balancing the checkbook, managing financial affairs, and so on. There are a lot of things that can cause dementia. Alzheimer's disease is just the most common cause or the most common diagnosis.
Now, do you develop it at a certain age, or can you live a good life and never get it? Or are we all prone to getting one or the other?
It's hard to say. It is certainly age-related in that it's relatively uncommon in younger people, say under the ages of 50 or 60 or so. But as we get into our 60s and 70s and 80s, the risk does go up pretty significantly. In fact, they say that over the age of 85, almost 50% of people do have Alzheimer's disease.
Wow. Now, how dangerous can it be? Because many of our grandparents, my grandmother is 90, yeah, she's 90 this year. She still drives. Despite, you know, the protests from my parents. She probably shouldn't be driving, but I think lots of families go through that experience where they have to tell the elderly person in their family not to do certain things, not to drive, not to do, you know, stand on a step to try to reach something in a cabinet. But they, you know, forget that they can't do those things.
Yeah. I guess the biggest concern to family members should be when these memory problems and changes are happening persistently. For example, we all forget where we put our keys, our shoes, and this and that.
That happens to me every day.
But it's when it becomes almost daily and causing problems, that's when we start to worry that there may be something else going on, that it's not just some normal forgetfulness, that maybe there's something more serious like Alzheimer's disease or a precursor to Alzheimer's disease.
And how do you diagnose it? I mean, what are the warning signs that a family member can say, I should take my loved one to the doctor now, it's time?
When we repeat ourselves frequently, when we start losing things on a daily basis, if we accuse people of hiding our things, even though that really doesn't make sense to the rest of us, these are some red flags that there may be something more serious going on.
And how do you treat it? Is there medication for it, or is it something that you just have to work through?
There are some medicines that help with the symptoms. Unfortunately, we don't really have anything that is curative, although scientists are working very hard to find something stronger than what we have right now. But we do have medications that can help stabilize or improve symptoms, maybe 6 to 12 months or so. But unfortunately, eventually, the dementia gets so severe that it overwhelms what the medications seem able to help cover.
Wow, so it's something that over time I guess you just have to accept.
We think of it like, as my nurse practitioner tells our patients, that this is a chronic disease like diabetes. This is something that our patients and families have to manage over the course of many years. Fortunately, it's not something that happens overnight. It's a slowly progressive problem. So ideally, it gives us time to get our affairs in order to help plan and make preparations and whatnot.
And this is something we shouldn't be in denial about, right? I mean, not just the person affected with the disease, but also the family members who are left to care for the loved one.
Exactly. Unfortunately, people who have Alzheimer's disease often don't really recognize how much of a problem that they're having. So while it might seem that they're in denial, it really probably is the case they just don't understand what sort of problems are happening. But I think you're right, for the family members and for their friends, they do need to sometimes step up and help to make some difficult decisions.
Yeah, and that's, I mean, in decisions like that, there's no way around it. I mean, it's difficult. You have to figure out how to work through it and also maybe look for help. Is there other support groups out there for family members? There
are a number of local churches and other organizations that have support groups, and I often have my patients go online, and Google's a wonderful thing, and they can find all sorts of good resources online for information about Alzheimer's disease in general. I often refer patients to the Mayo Clinic and Johns Hopkins websites. They have some pretty good patient-specific and patient-friendly information that family members can read about.
Excellent. Thank you, Doctor. And here's the information on your screen. You can visit the Seton Brain and Spine Institute Neurology program. The number is 324-3540. Thank you so much for being here, Dr.
Thank you.
Bertelsen.
Thanks for having me today.
Sure. Thank you. And